Now, little babies love to sleep, don't they? So whenever clients come to me with a baby who is under 6 months of age, it may be newborn, it may be 3 months, and the baby's not sleeping or they're finding it really difficult to sleep, I always want to get to the bottom of that and know why. It's never a case of simply sleep training these little babies. There's always a bit of a mystery to unpick. Now, a lot of these tiny ones will have already had the diagnosis of colic and or reflux, and many people feel that that is just part of having a little baby and it's a condition that affects them and they just have to ride it out. Now, the thing is with colic and reflux is there's always a cause. It's always a symptom of something, so we have to get to the bottom of the cause and treat the cause rather than just treat the acid reflux. Now, a common cause of this can be oral ties, so tongue ties, lip ties, cheek ties, and we're seeing it more and more commonly these days. It can cause all kinds of problems with the latch, with the suction, with the swallowing, and that can result in either very fast feeds or very slow feeds, either of which can cause discomfort and a grizzly baby. So if it's taking the baby a long time to get milk, they can just be permanently hungry and it feels like they're just hanging off the breast all the time. If they're getting a lot of milk very quickly, then you might see them pulling off and kind of getting drowned in milk because they're unable to control the flow of the milk when oral ties are present. So these babies will hop on and off the breast or seem to struggle with the teat on the bottle, and they're often quite tricky to settle for sleep. They can lose weight, they can gain weight quickly, and in many cases, when clients come to me, they've already seen multiple health professionals. They feel like they've ruled out every possible condition and they still have a baby that won't sleep. Now, in this situation, I would always want their mouth assessed and the feeding assessed. So even if bottle feeding, I would really urge you, if this sounds like your baby, to get in touch with a lactation consultant who is qualified in diagnosing oral ties and who believes in their significance. Unfortunately, not all practitioners realise just how detrimental oral ties can be to feeding and comfort of babies. Now, since the beginning of this year, I've been lucky enough to work alongside a local lactation consultant who sees a lot of clients who have maybe seen many other health professionals and feel like they just don't have the answers. They feel like they've been dismissed, particularly if the baby's putting on weight at a good rate. Many will assume that, feeding is fine and nothing needs to be done. But if these babies are suffering with colic and reflux and they're unable to sleep, of course, parents are going to be frantic for answers. So we have a lot of clients coming to us at our drop-in centre. So this is every Tuesday in Seaford between 10:30 and 1. Anyone can come. It's a free drop-in where we are more than happy to answer any questions related to babies, not just feeding, but if you need a feeding assessment and you would really like your baby's mouth checked for oral ties because you've explored every other avenue and you still feel like your baby is colicky and refluxy and cannot sleep, this is what I would really recommend as the next step in discovering what could be going on with your baby. From there, we're able to put you in touch with the correct professionals to get this worked on. Now, of course, a lot of people feel scared at the thought of having to get tongue ties cut, but it's not always the case at all. In many cases, they can treat the issues that go hand in hand with tongue ties, cheek ties and whatnot by having some craniosacral osteopathy treatment. So that can really help loosen any associated tightness that the baby may have, because of course that can affect feeding just by baby being uncomfortable. So by doing that, it can loosen everything up and improve feeding. So having a revision of tongue ties by a specialist dentist is not necessarily the outcome of a diagnosis for tongue ties, but it's still worth knowing so that we can be aware of what we're dealing with and find ways of moving forward and hopefully getting you the sleep that you're looking for.